Hey you guys, coming to you from SUNBURN, Colorado. We like to come out here a few times a year, Lake City, do some maybe skiing or hiking. We just climb Mount Handy's over in Lake City. And today, just doing a little fishing. And probably the world's worst fisherman, but I try, and I've caught one trout. It's about the size of a pencil, but pretty much life is like fishing. It's a lot of patience. It's like a box of chocolates. You never know what you're gonna get, but we want to grow and learn from each little step that we take. And you know, habits are super important. Our daily habits shape us, and get into a place where you can relax every now and then, clear the head. Super important. So today I want to talk a little bit about just my how I operate as a doctor, and how much I like the internet. I like the internet because you pose a lot of comments and we can respond and grow with that. And the internet age is what we live in. It's basically an information age, informational boom. Information's at our fingertips. We gotta know where to look. And the internet's good because we can get together and share ideas and resources and share with others and get to the bottom of things and share evidence. So it becomes very widespread amongst each other. And I always tell my patients to use the internet because it empowers them to learn about their condition, to research it. And I did see a study. You know, comment in the below comments for if you find that study. But I think it's about patients at Google. They can pick up rare conditions that their doctor missed, and so that's why I am a fan of patients Googling. I'm not one of the doctors that say, "Oh, you shouldn't Google it. It's annoying." And you know, I think some of them worry about the hypochondriac patient. They continue worried about, oh, I might have this condition. But sometimes it's good to research and learn, but trying to find the right resources is key. But I think it's important that patients work together with their doctor and to figure out, you know, learn more about their condition and why it's important to treat it, and just answering those simple questions like, why do we want our health? And that's important to kind of motivate us to stay healthy and be there for our family and our friends and our kids and our grandkids. And so, yeah, just quick little thoughts on the lake today, and hope you guys are staying healthy and happy. And speaking of comments, responding to comments, part 1 was supposed to be the idea of this video, and there was questions on metformin. David Sinclair takes it. Super smart guy. He does a lot of research, and he's a Harvard geneticist, author of way too many studies, and he takes the metformin, has anti-inflammatory, anti-cancer properties associated with reduction in mortality. You know, I'm in my 30s, my A1C is super low, my inflammation levels are low. I don't take metformin right now. There's some rare cases of lactic acidosis with metformin, and may not be good for the kidneys. You know, this is another thing about that research. Post in the comments below if you have some ideas on metformin and why it may not be good to take. I think I've heard David Sinclair say a lot of forward-thinking type doctors will recommend or might prescribe it for you, even if you don't have pre-diabetes or diabetes. So that's one of the scenarios where you could find that. But I would say generally I just give it to pre-diabetics and diabetics. And would I give it to non-diabetics? After reading Dr. David Sinclair's lifespan book, you know, there are a lot of benefits of metformin. I would be open to it, but it's not really an FDA indication at this time. And so, yeah, I think that's one of the medications that I do like. I do try to practice mostly lifestyle medicine, is called, where we try to prevent and reverse disease naturally, which actually the Hippocratic Oath says do no harm, and that we should try to practice prevention medicine as a doctor, which, you know, that's an interesting thing. A lot of doctors nowadays, they're not really trained in lifestyle medicine. You know, nutrition training is very limited, and so it's always good to keep doing your research and continue to read and grow and share ideas and comments and resources, and I think some things that we all can agree on is trying to get rid of oils. You know, oils are very fattening and put on a lot of calories. Of course, all the processed food, a lot of salt, and the more we can minimize all the processed food, that's going to be a huge win. And currently, I'm usually just recommending the whole food plant-based diet because that's the only one that's been shown to reverse our #1 killer. And other diets may do that. They just haven't shown that yet. But I would say big picture is trying to get blood pressure down, the A1C, your average blood sugar test down. Those are all key things for health and longevity. And staying active every day, and keep following me for more tips. And I'm doing a daily tip now on TikTok, just a little 15-second thing. So check that out, just different ideas on health. And I'm trying to do it to where it's not too overwhelming. So many these lengthy videos where it's like, oh, I just want a quick 10-second tip on health. And that's kind of what I'm trying to offer with that. So you can keep with your daily business and your financial goals, and your say if you have a busy job, busy kids, and you're busy with the children, I totally get it. It's hard to watch these 10-minute, 20-minute videos on health and read a bunch of books on health and nutrition. So I'm trying to break it down a little more quick, simpler tips. And key questions I want to pose to you guys today in the comments are, why do you want your health? Why do you want to, if you do want to live to be 100, and what motivates you to stay healthy? And there's a big picture now. It's called Whole Health. It's an initiative where trying to take a patient into all the dimensions from sleep, nutrition, what are they eating, their social relationships with their wife, their spouse. That can play a big role into your psyche. So yeah, so good stuff. And I was gonna do a video on sunburn tips, but big things on sunburns are always wear long sleeves. I got burnt climbing that mountain the other day. It's a 14,000 foot Handy's peak, and I did not wear a long sleeve UV blocker, so I'd always recommend that. I'd also recommend big hats, cover the neck up. Wrinkles come from too much sun damage, and skin cancer, melanoma. It does happen. Usually one die in their 20s from that. So as much as we like that rich mahogany tan, let's try to always cover up. And I've seen someone try to use Vaseline on a sunburn after, and that's just, I want to make that well known that it can trap the heat and make the sunburn worse. So try to avoid those oily substances. And yeah, you guys have a good summer. Hope you're staying healthy, and God bless.